Hello, my name is Mohammed. I am a fourth year dental student attending Gulf Medical University, and today I'll be discussing the effects of disclosing agents on patient motivation. First of all, I'd like to begin by explaining what a disclosing agent is. A disclosing agent can come in many forms, either tablets, lozenges, or solutions. Essentially, it is a dye containing vegetable dye, and an example of such dye is phloxin B. And what it does is it stains plaque and calculus within the oral cavity. There are several types of disclosing agents: the two-tone disclosing agent and the three-tone disclosing agent. The two-tone disclosing agent shows us where old plaque and new plaque has formed within the oral cavity, whereas the three-tone disclosing agent can not only distinguish between old and new plaque, it can also show us where the bacteria is highly active. It does this by disclosing the acidic pH. Of course, as we know, the acidic pH provides the optimum environment for the karyogenic activity. I would like to introduce a friend of mine, Khalid Youssef, who would be my volunteer today. I will ask Khalid to use the disclosing agent before brushing and after brushing. I will then assess the differences in plaque accumulation before and after brushing. After Khalid used the disclosing agent, I noticed that there is heavy plaque accumulation in the mandibular anterior teeth. The disclosing agent is darker on the cervical margin, indicating that the heaviest plaque accumulation is in the cervical region. It decreases as you ascend the tooth. The maxillary incisors seem to have light accumulation in the middle one-third. However, the disclosing agent is dark blue in the cervical margin of the maxillary canine, indicating that there is heavy plaque accumulation in that region. The posterior teeth seem to have light accumulation on the pits and fissures. However, the smooth surface seems to be somewhat average for a person who hasn't brushed his teeth in the past couple of hours. I will now transition to a picture of his teeth after he brushed his teeth and used the disclosing agent again. After Khalid brushed his teeth, the difference is not to be understated. You can clearly see that the plaque in both the upper and lower anterior teeth has significantly decreased. However, it is important to note that there is still some plaque remaining. This is clearly to be seen on the upper lateral incisor where Khalid still has light plaque. This may be due to his brushing technique, or Khalid may need to visit the clinic for routine scaling and cleaning. In conclusion, after asking Khalid for his opinions on the experiment, he said that he didn't realize how much plaque he actually had prior to using the disclosing agent. He was amazed when he saw the results and asked me for tips on how to properly practice adequate oral hygiene. This had led me to conclude that the disclosing agent can heavily impact the motivation in a positive way, as the patient can clearly see the differences which he couldn't see before using the disclosing agent. Thank you very much for your time. Have a good day.